One of the worst symptoms I've seen hospice patients have is terminal agitation. Terminal agitation is one of the most challenging and distressing symptoms for a person at the end of life. And not only for them, but for their caregivers, especially family members, as they're watching their person really suffering and not able to help them in any way. Okay, so what is terminal agitation? What causes it? What does it look like? And what can we do about it? Well, first of all, people can be restless at the end of their life, moving around in the bed, fidgeting with their hands. That's okay. It's usually for short periods of time and they can be redirected. But if they're like restless supersized, usually trying to get up out of the bed over and over, and they're incoherent and you can't redirect them, that might be terminal agitation. People who are at risk for terminal agitation are very young or have very young children, or anyone of any age who's experiencing an existential or spiritual crisis. It can also be caused by severe physical distress from pain or other symptoms that aren't able to be managed with the usual drugs. Because a person is incoherent, if the source is spiritual or existential, we can't really do anything for them in the way of non-pharmacological treatment, such as counseling. If we think the source is physical and the medications they're receiving for that are obviously not working, we're going to have to go with stronger drugs. Either way, medication is going to be the treatment for terminal agitation. Enter palliative sedation, which is a rapid introduction of a sedative medication to render deep sleep, unconsciousness. The decision to do palliative sedation is not made lightly. A person who is to receive palliative sedation needs to be close to death, usually within a few days. Everyone in the family needs to be in agreement because it can be viewed as euthanasia, although it definitely is not. And the patient has to be in an environment where there are reliable caregivers, which can be in a private home. The medication can be administered with a pump. Usually we use Versed, or we can give them injections of phenobarbital. Terminal agitation always signifies the end of life is near. Most people will die within 3 days of starting palliative sedation.